Hi, Dr. Edward Schuster with your tip of the week. This is my last New Year's resolution. What's wrong with American medicine and can we fix it? Now, let me start by saying I trained at Duke and Johns Hopkins and I'm on the Columbia faculty, and America has the best medicine in the world. However, I do have some complaints. Number one, deductibles and copays. I hate these. These are ruining American medicine. Patients are getting insurance, and even the Affordable Care Insurance has deductibles. They get something done, and they get a bill for $2,000, $3,000, and they say, I didn't know I had a deductible. I can't pay this. And the next thing you know, they're in collection. So the whole idea of large deductibles and copays is really stopping people from getting the medical care they need and hurting them financially. We need some kind of fair insurance system where you pay for insurance and that pays for all your medical care. You can't really expect people to be able to pay thousands of dollars out of their pocket. Number two, the computers. They say for every patient a doctor sees, he or she spends 16 minutes on the computer. Now, my computer is a good secretary and it's good for billing. It helps with prescriptions, but it doesn't really help me save lives. There's no artificial intelligence. It doesn't tell me if a patient's not on aspirin. It doesn't tell me if a patient's overdue for a colonoscopy. It doesn't tell me if a patient's taking 3 medicines for high blood pressure, but really hasn't filled 2 in the pharmacy for months. We need help. We need artificial intelligence to help the doctors in their office and in the hospital save lives. And last but not least is the government and Medicare punishing doctors and hospitals for what they say is poor performance. Now, I think if you ask people, who do you trust more, the government or your doctor, I would think 99% would trust their doctor more. So what's happening now, it's called readmissions. If you're admitted to the hospital and in the next month you have to go back again, that's considered bad medicine, and the hospitals are being financially punished. So take congestive heart failure, which is the number one admission for patients. If you come in with congestive heart failure and come back within a month, the hospital loses money. So everybody is trying to prevent this. But it's very hard. Congestive heart failure is a bad disease. People are older, some people are poor, some people are drug addicts, some people are alcoholics, and it's impossible really to keep people from coming back into the hospital. So what's happened? The readmission rate has gone down 12%. So Medicare's happy because 12% less people are coming back within a month. But guess what? The death rate has gone up. So because we're trying to keep people out of the hospital, some people end up dying. This cannot continue, so I think the whole readmission business really needs to be reconsidered. So this is my tip of the week. If you think this is important, please share this with your friends. Have a good day.